biceps brachii is one of the most iconic muscles, but it is also a common source of pain and dysfunction. In this video, you will learn how to examine biceps with ultrasound. Hi, my name is Jakub. I am a physical medicine and rehabilitation specialist. In today's video, we will go through a complete ultrasound examination protocol of the biceps brachii. We will go through each part step by step, focusing on the proximal, middle and distal part of the biceps. This is essential for accurate diagnostics of tendon or muscle pathologies. Let's get into it. We will begin the examination by assessing the proximal biceps, focusing on both the long and the short heads of the biceps brachii. We will scan them both in transverse and longitudinal plane. First, let's examine the long head of the biceps brachii in the transverse plane. You should see the tendon as a bright, oval-shaped structure sitting within the bicipital groove between the greater and lesser tubercles. You can follow the tendon distally to its myotendinous junction. Now, let's switch to the longitudinal plane. Rotate the probe to align with the tendon's long axis. You will see the long head of the biceps tendon stretching out like a bright band. A healthy tendon should resemble the appearance of spaghetti. This view is great for evaluating the tendon's integrity, especially for detecting any tears. You can also follow the tendon distally to the myotendinous junction. Next, we will scan the short head of the biceps brachii. Tip to find is to follow the long head distally till you see the muscle belly of the long and short head. Afterwards, follow the short head proximally and the tendon will appear. The tendon of the short head of the biceps is usually thinner and harder to find. When we follow the tendon even more proximal, we will find the coracoid process where the tendon inserts. Now, rotate the probe to visualize it longitudinally. You should see parallel fiber pattern. Tip to finding it is to find the coracoid process first and then align the probe with the long axis of the arm. When you follow the tendon distally, you can find myotendinous junction. In the middle part of the biceps, we will examine the muscle belly. I will show you how the healthy muscle looks like both in transverse and longitudinal plane. Let's first scan in the transverse plane. Place the probe perpendicular to the long axis of the arm. You will notice the muscle fibers appearing as hypoechoic, dark, interspread with hyperechoic, bright connective tissues. A healthy muscle should look like a starry sky. In this plane, you can look for swelling, hematomas or muscle tears. When we follow the muscle distally, we can see the distal tendon of the biceps appearing above the brachial muscle. Now, rotate the probe to scan the muscle belly longitudinally. The fibers will appear as long, parallel streaks. This view is great for detecting fiber alignment and any signs of muscle damage. As a bipennate muscle, biceps in long axis should resemble the appearance of a feather. Finally, we will examine the distal biceps. This includes evaluating the distal tendon both in transverse and longitudinal plane, as well as using specialized views for more detailed assessment. Now, let's move to the area just above the elbow joint. Starting with the transverse plane, we can identify the biceps muscle transitioning into a tendon that sits on the brachialis muscle. Beneath the brachialis, we can see the cartilage of the humerus and the humerus itself. Lateral to the biceps tendon, we can observe the brachioradialis muscle. Between the brachialis and brachioradialis muscle, we can locate the radial nerve. Medial to the biceps tendon, we find the pronator teres muscle. Between the pronator teres and brachialis muscle, we can identify the brachial artery and median nerve. We can follow the tendon distally to its insertion to the radial tuberosity. Rotate the probe to the longitudinal or slightly oblique plane. The tendon will extend across the screen, allowing you to assess its continuity and thickness. In some patients, it can be challenging to locate and visualize the distal biceps tendon, so there are several other scanning approaches available. For the pronator window, we position the probe medially over the distal arm. In the transverse plane, you can visualize the distal biceps tendon and its relationship to the pronator teres muscle. In this view, the tendon is behind the brachial artery. We can also follow the tendon to its insertion. Next, rotate the probe longitudinally to view the distal biceps tendon and its insertion to the radial tuberosity. This helps in assessing any enthesopathy or distal tendinopathies. Now, for the lateral roll view, position the probe laterally. This view provides a unique angle to visualize the distal biceps tendon and the myotendinous junction. We can dynamically assess the tendon performing pronation and supination. Finally, the cobra view is used to obtain a detailed look at the distal biceps tendon as it wraps around the radius. Position the probe on the forearm between the radius and ulna to achieve this specialized view. You can dynamically assess the tendon by having the patient perform pronation and supination movements. And that's it. We have gone through the entire ultrasound examination protocol of the biceps brachii. If you found this video helpful, don't forget to like, subscribe and let me know in the comments. See you in the next video.